My story is a little bit different. I went to Clemson. I'm a Clemson guy, not too many Clemson people in this part of the state, but I studied mechanical engineering. And growing up, I used to like to design things, build things, good at math, good at science. And so I said, asked my dad, I said, where does this lead me? And he said, I think you ought to do engineering. So I went to Clemson, graduated in 1984. I was there for the first football heyday, right? We were national championships during my tenure there. That was really cool. And I studied mechanical engineering. So I got out of Clemson and I went to work as a project engineer and worked for 4 years, and then kind of said, maybe I want to do something a little different than what I'm doing, and didn't quite know which direction to go to, and started thinking about it and looking into it and realized that Clemson had a bioengineering program. So I went back to school and studied bioengineering and got a master's. For that entire time, my roommate in college is an OB/GYN, lives in Greenville, South Carolina, so he was always pre-med and he was always talking to me about medical school. I never gave it a second thought. And then I got into graduate school and we started doing some animal research and some projects that were very interesting. And our focus was either cardiovascular or orthopedics. And I got interested in medicine. So I decided to look into that and say, maybe I want to do something in the medical field, and started looking at it really hard and decided I really wanted to do orthopedics. And some of that's just because most orthopedic guys love to fix things. That's just sort of their background. They like to have a problem and a solution. And that fits really close with engineering. You have a problem and then you figure out a solution. So that's what I decided to do. Some of it is who you're around when you're doing your training. And that plays a big role because you have mentors really that take you under their wing, and they're physicians or surgeons that you really like and you respect. And I happen to be around some very good hand surgeons. I was up in Tennessee, in Chattanooga, and doing an orthopedic residency, and I really liked the hand guys. I thought what they did were interesting, and those individuals were interesting as well. And they started steering me in that direction a little bit. And it was either going to be hand surgery or maybe joint surgery. Those were kind of my two options, and I picked hand. I just think hands, it's very interesting. The anatomy of the hand is incredible. The balance of all the tendons and the way the joints work and all that is very, very interesting to me. And it is very mechanical in a lot of ways. And so it was sort of a natural fit. I'm one of the guys, some people start medical school and they just want to be a doctor, and they kind of figure out their pathway when they get into medical school. I wanted to be an orthopedic surgeon before I got into medical school, which is a little risky because orthopedics is very competitive, and I think it's very competitive because it's a neat profession. I mean, that's the bottom line. We get to do something that's very, rewarding, and so because it's a neat place to be, it's also a very popular specialty. So when you're in your class with 150 students, X number of people want to do orthopedics, but everybody didn't get the opportunity. So as a freshman, you got to make good grades and you got to be pretty high ranked in your class to get that opportunity. So there's a little pressure going in, trying to excel and do things well and get noticed and that kind of stuff. We are very subspecialized, and we have 5 hand surgeons here at OrthoGeorgia, and everybody that works with us has a hand fellowship background. And essentially what you do is you take a base background, which in our case is 4 of us are orthopedically based and 1 of us is plastic surgery based. And then you do additional training to learn a lot of the intricacies of the hand and specifically the surgery of the hand. So fellowships typically are a year, and your entire focus is hand and upper extremity. And in doing that year, you get a lot of experience working specifically on hand problems. But then when you add to that, how does your board certify you as someone that has a little bit of higher level of knowledge base and expertise? And the way the board does that is they have an exam. We used to call it the CAQ, Certificate of Added Qualifications, and it's an added level of expertise. So you have to be fellowship trained in order to sit for the CAQ, and then when you pass that exam, you also, just like you do for board certification, there's typically a 10-year recertification period. So you pass your boards. The good news is you pass and you're qualified and you're certified. The bad news is you got to requalify every 10 years. So it's the way that you keep up to date with technology, keep up to date with medical knowledge, and in our case, keep up to date with hand progress as well. So when someone has a CAQ, it just means that they have done that extra level of work and training to reach a level of expertise that the average person wouldn't have in orthopedics. Macon's a little heavy. We kind of have 5 surgeons here, which is kind of unique. We're kind of a hand center for the central part of the state. You know, Atlanta has a big focus. Savannah has some focus. But primarily, you know, we're kind of from here to Florida, we're kind of it when it comes to hand surgery. And so some of the more complex things, either unique hand conditions or unique hand injuries, get pulled into Macon. And I'm one of the surgeons that takes call at the medical center. And so if someone, Valdosta, Tifton, whatever, gets hurt and it's a bad enough injury, they come to Macon for their treatment, because there's not a hand surgeon in their community that can handle that. So we do have a bigger draw in that regard regionally. Now, north of Macon, when the closer you get to Atlanta, most of those patients stay in the nucleus of Atlanta because there's a large percentage of hand surgeons there. But south, for Macon area, central Georgia and South Georgia, tends to come to Macon. You prepare in a lot of ways. You prepare because you read journals. You prepare because you talk to your other hand surgeons, and you talk about problems and you know, kind of discuss treatment options. And you go to courses every year to learn new techniques. You go to the Hand Society every couple of years, and then in my case, I also do some review. You know, when it's coming closer, I do some review ahead of time, because it means a lot to pass. It means a lot to get that behind you and recertify for the next 10 years, and you want to go ahead and you know, make it successful. So the only thing I would say that makes me different or unique in this group is that I've been lucky enough to get to use some of my outside interest in a way that helps OrthoGeorgia, and that comes a little bit from my engineering background. We're sitting in our main building here at Northside Drive, and when this project was started, I was the head person, the lead person on the building committee to get this building up and running and constructed. And we're currently building our spine center right out here in the parking lot, and I'm running that project basically from the partner standpoint. So I'm the physician in the practice that's in charge of the building, and I love it.